our Lord Jesus Christ was not born in a castle. He was not born in a palace. He was born in a simple stable. So that means that the baby Jesus identifies himself with the poor. So I encourage my friends that those of us who have been blessed with sufficiency should be able to share with those in need, especially at this time of the pandemic, Pia, when a lot of people are out of jobs, a lot of people are in need. So this is a good opportunity for us this Christmas. In fact, every month of the year, but especially Christmas, that we should share our blessings.
Okay. I remember last year in our Christmas special with your children, you said specifically that the gift you asked for from them was to donate to charitable causes or to help other people.
Yes.
So that's the same thing that you asked for.
Yes. And we try to visit orphanages and to see that they are blessed with sufficiency, but there are many who are not. So share your blessings. I always think of the three kings who came to visit and they brought gifts to the baby Jesus.
And of course, Tito Joe, our gift to the audience come Christmas time will be another Christmas special with you, right? And your children.
I'm looking forward to that.
For taping in very soon.
Yes.
Thank you so much, Mr. Jose Marichan. I won't say Mr. Christmas na para.
No.
Thank you, Tito Joe. Thank you for being here. And that is it for tonight. Join me again on News.ph at 7 p.m. I'm Pia Ontiveros for News Night, where we go above and beyond the headlines.
RPN Radio Philippines Network. DXTV Dipolo Radio Ronda. Sa Pride Anti-Bac Detergent, limpyo ang ilaman, not out ang bakterya.
Stop ang germs and Pride with Anti-Bac.
This program is rated PG. It contains themes and scenes which may not be suitable.
Adunay germ knockout action. Kills 99.9% of germs sa biste sa pamilya.
Stop ang germs sa Pride with Anti-Bac. Linis ang labada, nakatabakterya.
Pride Anti-Bac Detergent. Manufactured by ACS Manufacturing Corporation. ISO certified, world-class quality.
ACS.
Time check, it's 6:30 in the evening.
That time check was brought to you by ACS Manufacturing Corporation. ISO certified, world-class quality.
ACS.
Para sa sinina nga ka-bloom sa kahumot, suwayi ang Charm Fabric Conditioner.
Charm Factor, bagong gumagabloom. Charm Factor, gamitin may bangon sa libong bulaklak.
Charm Fabric Conditioner. Dunay Stay Fresh Technology. Sinina nga ka-bloom sa kahumot.
Charm Factor, bagong gumagabloom. Charm Factor, gamitin may bangon sa libong bulaklak.
Charm Fabric Conditioner. Manufactured by ACS Manufacturing Corporation. ISO certified, world-class quality.
ACS.
RPN Radio Philippines Network. DXTV Dipolo Radio Ronda.
The body has its own way of healing. When you injure your cartilage, the tough, slippery tissue that covers the ends of bones where they form a joint, the body repairs the damage by creating a new bone in the area. Now these lumps are what we call bone spurs. In this episode, we'll take a closer look at what bone spurs are and how they affect the body. I'm Dr. Freddy Gomez, and this is MedTalk Health Talk on CNN Philippines. Our guests are here today to guide us on what are bone spurs. With us is Dr. Mikhail Louver. He's an orthopedic surgeon at St. Luke's Global City and assistant professor at St. Luke's College of Medicine. Also with us is Dr. Franklin Domingo. He's a rehabilitation medicine specialist from the Asian Hospital and Medical Center. Bone spurs, a lot of our viewers who hear of bone spurs, its medical term is osteophytes. I'll start the conversation with Dr. Miko. When we talk about osteophytes or bone spurs, what exactly are these? What are we talking about here?
They are essentially a reaction of bone whenever they come into contact with each other. So it is most commonly seen in the most common condition, which is osteoarthritis.
Dr. Frank, what are the more common ways for a person to know that they have osteophytes or bone spurs?
Patients come to us in our clinic, they often even don't have an idea about what bone spurs are. But then when they come in because of neck pain, back pain, heel pain, knee pain, or hip pain, we ask for an x-ray, and invariably a result will come out. And they begin to ask, is this the cause of the pain, or is this something that's just incidental? Is it a pain generator? So that's how we usually encounter the patients who complain of bone spurs.
Now I'd like to ask Dr. Miko naman, when they come in for pain, what are the more typical parts of the body would someone feel these osteophytes or these bone spurs? Where do they usually come out?
Essentially, if you look at epidemiology or numbers, it is actually on the knees, which is the most common area where these patients would come in for pain. Next would be the feet, the hands, and then the back as well.
Dr. Miko, you mentioned about the knees, the feet, and whatnot. They come in for pain. Let's talk about the character of the pain that someone would usually feel when they do have a bone spur. Is something significant with the pain? Could you describe the kind of pain that a bone spur would elicit?
Bone spur pain would give out some form of localized or direct pain on that part of the body. Where it is the knee, then the pain would be localized on that knee region or somewhere close to it. There's also a concept that we call it radiates somewhere close to that area. So essentially, it is pain. It's like point tenderness pain. Whenever you point to that region, that is where it's most painful at, then most likely it is because of consequence of the bone spurs.
Now, Dr. Frank, let's talk about that a little bit. Could you expound a little bit more on how bone spurs occur in the process of repair?
Yeah, it's your body's failed attempt at trying to repair damage that has been caused through wear and tear. Most specifically in patients with arthritis. And it usually happens in joints where we have a lot of loading. So when damage occurs in these joints because of injuries, overuse, or just simply wear and tear, it's the body's own way of trying to heal itself, but invariably it just doesn't work out the right way, and we have bone spurs, and when they touch on nerves that are sometimes around these structures, they invariably cause pain.
Now, apart from repairing injuries to our bones and joints, are there other causes of bone spurs, Dr. Miko?
It usually comes into play with regards to medical conditions. So these come into play with some conditions like rheumatoid arthritis. These come into play with gout or gouty arthritis. And these are more of the medical arthropathies or medical joint pains that we also see in clinic.
Dr. Miko, are there certain people who are more at risk of developing bone spurs? I hear a recurrent term here is osteoarthritis. So are there certain age groups who are more at risk of getting bone spurs?
The most common age group, it's actually the middle age to the elderly age group. There's actually a study done in PGH wherein they essentially mapped it out somewhere around 60 years old, where these patients would come into your clinic complaining of the joint pain. One of the biggest factors as well that you could commonly see in medical literature is that these patients who develop these joint pains outside of the age parameter or the degenerative problem, especially when they come into play, when they come into you at an early onset of an age, then we have to think about some form of genetic or medical problem that would lead to these bone spurs.
Now, Dr. Frank, is it sort of inevitable for the elderly or those advancing in age to have bone spurs? And if that is the case, are these relieved or not relieved for that matter with your common pain relievers such as those like non-steroidal anti-inflammatories?
Bone spurs are much like taxes, as some other doctors would say. They're like taxes and death. They're unavoidable. They just happen. And as with regards to the treatment, when using non-steroidal anti-inflammatory drugs, they would probably just relieve you of the pain. But is it addressing the root cause of the pain? I don't think so.
Can diet do anything with osteophytes or bone spurs for that matter? A lot of our viewers try to prevent this by eating healthy, taking calcium supplements and whatnot. Will these do anything in trying to prevent osteophytes from happening?
I think they will. They will help. Especially studies now have come out that a Mediterranean diet, which is high in olive oil, green leafy vegetables, different colors of fruits, I think diet may play a good part. Supplements, I'm not so sure if there are any supplements that could alleviate the symptoms or the progression. Although they did have some studies that have come out that a deficiency in certain vitamins like vitamin B, vitamin E, and sometimes even vitamin K have an increased occurrence of bone spurs in some patients.
Dr. Miko, before we go into break, can bone spurs occur because of the way certain people have handled their skeletal structure during their younger years? High-impact sports, carrying increased weight on their joints for that matter, ill-fitting shoes, all of these factors, can these contribute to having osteophytes or bone spurs?
Whatever the person has done onto their earlier parts of their lives, essentially it adds to the load on the joint. And then as we know that these bone spurs are a natural reaction to these overloading issues, then in a way it takes a chip daily into your joint longevity. Weight management together with exercise is the easiest way in terms of trying to prevent the progression of these bone spurs.
When we return, we'll discuss how bone spurs can be signs of a more serious problem in your body. We'll be right back here on Med Talk Health Talk.
Pride Bar, dili lang puti, kisla puti.
Pagilabhan sa Pride Bar Blue, ang puting sinina mahimong
Mas puti ito, mas puti ito, mas puti ito.
sa Pride Bar Blue, pwedeng dili na ko magtina, anyel o bleach. Kaya ang Pride Bar Blue, dunay power whitener nga sa gumsum sa matag hibla. Mao nga sinina, kisla puti ug humok pa sa kamot.
Mas puti ito, mas puti ito, mas puti ito.
Pride Bar Blue with power whitener. Dili lang puti, kisla puti.
Pride Bar, manufactured by ACS Manufacturing Corporation. ISO certified, world-class quality.
ACS.
I'm Dr. Freddy Gomez and welcome back to Med Talk Health Talk, where caring is our calling. Now, earlier we discussed what bone spurs are and what causes it. Now we'll discuss what other health conditions it may be connected to. Arthritis is the swelling and tenderness of one or more of your joints. Now, the most common type is osteoarthritis. Now, osteoarthritis causes cartilage to break down, and as we've mentioned earlier, the body repairs the damage by growing bone spurs. Now, Dr. Miko, let's talk a little bit about connection of arthritis and that of osteophytes or bone spurs. Is one dependent on the other?
Essentially, it is a cause and effect. So whenever these joints are overloaded, the cartilage begins to get damaged. And when these joints get damaged, the body's natural reaction is to try to stabilize or prevent or decrease the pain. And the only way for the bone to hold on to these structures is to produce more bone.
Dr. Frank, do we see the increased occurrence of bone spurs when the arthritis begins as well?
Yes, that's something which we can expect. As arthritis progresses, the amount of bone spurs that we see in patients' x-rays or in CT scans or in MRIs, we also see that they increase. Again, it's your body's way of trying to heal itself, but it's just not doing the right job. So that we have bone spurs and we have pain.
Now, Dr. Miko, given that bone spurs can be a result of arthritis, how do we lessen the risks? Is there a way for us to lessen the risks of arthritis, of developing arthritis to begin with?
Yes, there are ways, modifiable ways that we can do to prevent these to prevent the disease progression. And it is one of the easiest ways to do this is through proper weight management and through good exercise. Exercise is actually a very good way to strengthen the musculatures around that joint region. And once we get these good muscles around these regions, then essentially it is a way of unloading the joint.
Dr. Miko, could you give some exercises for the viewers that are not hard on the joints that are not high impact, but at the same time effective in addressing and trying to prevent arthritis and therefore bone spurs?
It's actually quite a tricky question because it depends mostly on the affected joint. But in terms of trying to look at it as an overview, we all have to remember that it is basically trying to unload the joint. And I think for me personally, one of the best and easiest exercises or sports that a person can do is through swimming. And swimming, there's actually a specialized form of therapy called aquatherapy that can help with these offloading activities for the joint. And not only does it offload you whenever you're submerged into water, it's because of the resistance of the water, it adds more, in a way, strengthening to the muscles around that joint affected.
Dr. Frank, let's talk about that since it's in your line of expertise when it comes to trying to get those joints moving but at the same time protecting them. One good activity is that of swimming. Is there any other activity, or how can our viewers maximize these activities in order to enhance their health, their overall bone health for that matter?
Swimming is probably the best thing that you can do because of the effect of buoyancy. As you know, buoyancy is there to take off the weight and stress off the knee joints and your hip joints and some of the joints on your back. But something more practical would probably be walking. It's the easiest thing you can do. Very simple. You don't even need a trainer. You don't even need a swimming pool. Simply walking to the best of your ability. A brisk walk would be nice. A brisk walk to a 90-year-old might be very different to a brisk walk for a 50-year-old. But trying to walk and trying to exercise, that's just one way of doing it. Mm-hmm. And another exercise, of course, is cycling because, of course, the seat that you're sitting on, of course, takes off a big chunk of that weight. And what are the things that we should avoid? Definitely high-impact activities like jogging, running, maybe playing tennis, playing basketball, anything at all that puts a lot of weight on that joint, we try to avoid that.
Now, we've been talking about ways to prevent it. Let's talk about therapies done for someone who is diagnosed with that of a bone spur. Dr. Miko, let's talk about someone who has a diagnosis of bone spur. First of all, is it easy to spot an osteophyte, Dr. Miko?
Yes, it is actually quite easy. A simple x-ray can essentially showcase where these bone spurs are located and how large they are.
So, Dr. Miko, once someone is properly diagnosed to have osteophytes or bone spur, what is the usual next line of therapy?
In terms of sequencing for therapy, whenever patients come into our clinic, it's because mainly of pain. And as doctors, we really need to address the pain first and foremost. So the usual course is essentially to start patients on a short course of non-steroidal anti-inflammatories. And also one favorite thing that I give to patients, which is quite effective, is like your ordinary paracetamol. A majority of these cases are in the mild to, essentially they are in the mild to at least a less moderate form of osteoarthritis or bone spur formation. And these can be readily treated by these medications.
Now, Dr. Miko, I noticed your first line of treatment was not surgery. Now, my question is, a lot of people say, I have a bone spur. Dr. Miko, why don't you just surgically operate that, get that out, and I'll be on my way? Why is surgery not the first line of treatment when it comes to not just bone spurs, but for a lot of diseases, actually?
To be honest, bone spurs, they don't actually cause too much of a pain, especially in the earlier stages wherein these problems start to develop. They actually become more bothersome and nuisance in terms of symptoms when they get to progress into the moderate to severe stage. So definitely, surgery is basically our last resort in terms of treatment. And we always try to focus on the conservative treatment options or the non-operative treatment options in treating these bone spur problems.
That being said, when we return, we'll explore the options you can take to lessen the symptoms of getting bone spurs. You're watching MedTalk Health Talk. We'll be right back.
Sa Pride Anti-Bac Detergent, limpyo ang nilaman, knock out ang bakterya.
Stop ang germs sa Pride with Anti-Bac. Linis ang labada, knockout ang bakterya.
Ang Pride Anti-Bac adunay germ knockout action. Kills 99.9% of germs sa bisti sa pamilya.
Stop ang germs sa Pride with Anti-Bac.
Anti-Bac Detergent. Manufactured by ACS Manufacturing Corporation. ISO certified, world-class quality.
ACS.
I'm Dr. Freddy Gomez, and this is MedTalk Health Talk, your partner in healthcare. Now that we know what bone spurs are and how they are diagnosed properly, let's discuss how different forms of treatment are and how they are there to prevent bone spurs from causing you more trouble. Dr. Frank, let's talk about some of the therapies involved when someone is diagnosed with having a bone spur. Depending on where they are, let's talk about the more common one on the knees and the feet. What type of therapy are patients expected to have when they are under your care?
What we can try to do is we can try to give modalities to decrease the pain. We could use heat, we could use cold, we could use transcutaneous electrical nerve stimulation. There are newer modalities right now such as shockwave therapy, which may actually help to alleviate these symptoms of pain. But more importantly would be exercise, especially the vastus medialis oblique, or it's part of the quadriceps group of muscles, which is involved basically in stabilizing the knee. So we need to do that.
When it comes to a timeline or a time frame where the patient can feel some relief from the pain, I know it varies from patient to patient, but on average, what kind of time frame are we looking at before they can actually feel better and the pain is much less?
We can usually feel some pain relief by starting the medications. So giving a short course of pain medications would be helpful while waiting for the longer term effect of rehab to come in. So while we're decreasing the medications, we're actually going up on the strengthening exercises, and that would probably alleviate the symptoms of the patient, not only in the short term, but also in the long term.
Now, Dr. Miko, can a bone spur resorb on its own? Meaning after good therapy, losing weight, and all this stuff, can the bone spur or the osteophyte resolve on its own, become normal on its own?
The short answer is no. Whenever these osteophytes start to form, they are basically permanent structures, and the only thing that we could do in terms of trying to grab onto these like bone spurs is to prevent the progression or further production of more bone spurs.
Now, Dr. Miko, let's talk about surgery for a second here. When is surgery an option for someone who is diagnosed with osteophyte?
It is always the last option that we take in terms of trying to control the pain. These patients would generally have the severe form of osteoarthritis wherein their joint space has completely eroded, and you can see that essentially whatever these positions come into, it's causing pain, whether at rest, whether while sitting. It's essentially a constant type of pain, and that's usually the tipping point in terms of trying to move forward into surgical management for these cases.
Now, Dr. Frank, when it comes to supplements, a lot of our viewers are really keen on this because there's so many on the market. You have chondroitin, you have collagen, you have calcium and all this. When it comes to osteophytes or bone spurs, could you give the truth of the matter? Is it effective? Is it best left alone?
There is no direct evidence linking the use of supplements such as chondroitin or glucosamine sulfate and calcium as to the progression of bone spurs.
Before we go, do you have any words of advice for our viewers, Dr. Miko?
My take with regards to these problems, it's actually more of a proactive prevention. Rather than we let these bone spurs progress, it's actually quite important that we try to maintain our body physique in terms of controlling the weight and also exercise. I've been seeing a lot of patients who, because of this pandemic, has significantly gone down in terms of physical activity. And I think in terms of moving forward and treatment of these problems, it's more going to be concentrated and should always be concentrated on prevention.
And Dr. Frank, your advice for our viewers?
Yes, and like death and taxes, bone spurs may be unavoidable, but then there are certainly so many things that we can do to control the pain. And the sooner that they see their rehab doctor, their orthopedic doctor, their rheumatologist, or any other doctor, the better we can treat them.
And with that, thank you very much, Dr. Mikhail Louver and Dr. Franklin Domingo, for being with us today. You definitely shared a lot of useful information for our viewers about osteophytes or bone spurs. I'm Dr. Freddy Gomez, and thank you for watching Med Talk Health Talk. We'll see you again next time.